medication?
I think this is the best medication a person could get. I think they're depriving the benefits from a lot of people.
My name's Lad Huffman. I'm 42 years old. I have multiple sclerosis. I've had it since '77. They have to try it to prove it to themselves, because I didn't believe it. To begin with, I was skeptical. I believed I smoked it because I like to smoke it, but I found out when I didn't have it that my symptoms were so much more severe. And if you try it, you'll find that it'll help the symptoms. I couldn't say it would help everybody, but I know it'll help some people. The doctor, if he cares about his patient at all, he should make an effort to give them the best care possible. It's a nightmare. You have to fill out reams of paper, and it takes months and months and months. I've been approved since this fall, and I still haven't gotten any product yet. It's a real hassle. It's unnecessary.
The problem we have now is that, like me, I finally made it through the program. Now none of the doctors tell me that it's anything bad. Only policemen do that, and only a few of them. I hear that occasionally. I'll hear a policeman say, well, marijuana is bad for you. As a rule, nobody says it's bad for you, because I'm living proof that it's not, that it's actually good medicine if used as medicine. I don't know about anything else. I don't even try to think about that. But a lot of my friends right now need this medicine, are using this medicine, and are risking everything they own. When, all the way from the White House Drug Policy Commission, to the drug czar, who have recommended that Health and Human Services let loose this stranglehold they have on the supplies of the marijuana and let the patients who have been approved have marijuana. Right now we think that's about 30 people. I don't have any way of knowing, because I'm not a politician or anything. I'm just a person who knows a lot of sick people now. Since people heard about me, they've been writing me letters, they've been calling me on the telephone, they've been coming to my house, and we've been making sure that other people knew about it, knew about us. We're not alone. You are not alone. Even the White House recommends that they cut loose the supplies, that the supplies are there. They have asked, I believe it was James Mason or possibly Lewis Sullivan, to stop holding back the supplies. And Health and Human Services, anyhow, is the one right now that's stopping these patients from getting it. Many of them are terminally ill. Their quality of life suffers terribly. Nobody that's healthy has a right to do that to me. If they took away my right to smoke marijuana, I would still go get marijuana and smoke it. I could not help it. I would die if I didn't have it. Of all the diseases that I've heard, I believe it may be an absolute stop for glaucoma. It may stop glaucoma completely. It seems to. It seems to do that to MS, or at least slow it down drastically. And for me, it might even have made me a little better. I've gained 8 pounds in the last 2 months, and that's literally impossible for a person who has what I have to do in the condition that I'm in, because I can't eat or sleep or etc. I was watching a slow, all my life I've watched a slow, progressive disability. In other words, what I could do when I was 18, I couldn't do when I was 20. What I could do when I was 20, I couldn't do when I was 25. And so to the point that all I could do was lay in the bed and squirm and yell. That even morphine no longer made me comfortable. Marijuana makes me comfortable. I'm the proof that you need. Please give it to the other people. Man, they are the proof that you need. They're there, they're using it, and they're risking their life. These are people that can't fight. We don't have the energy, and we don't have the means. You pretty much sucked most of them dry. The doctors got everything they had. There's nothing they can, pay to do this anymore. The doctors, the biggest drug pushers in the world, we all agree, and those of us that are sick think so a whole lot more than those of us who are not sick. I had one 3-month period cost me $300,000. I don't want any of my friends to go through that. They're already using it. It is medicine. Make it Schedule II now, and we'll apply for permits to make it available to patients. Pure, without chemicals, and what's needed. Taking the active ingredients out of it, raping the plant, making it as bad as you can, could cause me to have lung trouble. We want that stopped. We want the government to either give us a decent supply of something that doesn't hurt us because we have to use so much of it. And we would like it Schedule II. We're not asking for a lot. These are patients. These aren't people out raping or having, as Mr. Mason has suggested, having promiscuous sex and spreading AIDS.
Well, I was the first patient to receive legal access to marijuana in 1976, and I wouldn't recommend the way I went about getting it. I was arrested for growing 4 marijuana plants and had to go to court and demonstrate. My use of marijuana was not criminal, but an act of medical necessity. And in order to prove that, I had to go through 2 controlled medical studies, one at UCLA and one at Johns Hopkins. And even after those studies were done, it took another several months for federal agencies to respond to my request for legal access to government supplies. Since that time, the federal government has codified the procedures for getting legal access to marijuana through what's called a compassionate IND program. The compassionate IND program has existed for 13 years. It has assisted patients with a variety of very serious diseases, all of which are life or sense threatening: glaucoma, cancer, multiple sclerosis, paralysis, and most recently AIDS. It works. And Tim and his doctor got a hold of me in the fall of last year. Tim had realized as an AIDS patient that marijuana was critically helpful in terms of appetite stabilization and also in terms of helping to reduce the intense nausea and vomiting that can be caused by AZT and other forms of anti-AIDS therapy. Obviously, if you can eat and maintain your weight, you're in a better position to fight your disease.
How many people have you successfully helped get marijuana?
Over the years, maybe 40. Currently, of those still alive, there are 12 people who are using marijuana legally in the United States. There are another 50 people who, like Tim, have received FDA permission to use marijuana, but have received no supplies. This permission is meaningless in the absence of such supply. I'm trapped in a bureaucratic battle over how to handle medical marijuana, and the essence of that battle is being fought between those who believe the government's attitude should be somewhat compassionate, and if marijuana can help people, it should be available, and another group of people who could be described as war on drugs hardliners, who really don't give a damn about the welfare of seriously ill people, and who just want to fight an ideological battle over drug use.
Tim, you do use marijuana, right?
Yes.
How do you get it now?
Well, I just have to, you know, go out in the streets and get it. For a while, because of a program I was in, a housing program, you know, you weren't supposed to drink or use any other drugs like that. And I was having such a problem with the nausea and stuff and everything, like I mentioned before, where I couldn't have anything in my stomach, I couldn't hold it down, and I'd retch so hard that I would, you know, break vessels inside myself from that. And one day I just decided, well, if they kick me out of the program, they kick me out of the program. There was a part of a joint that my roommate had there, and I puffed on it, and it was like night and day, you know, the nausea. I'm convinced, and my doctor's convinced, that this is one of the things that has kept me going past the time they said I had, you know. So this is like a life and death thing to me.